Hello, hello, I'm Cody LeGros, and this is In the Loop. I'm sure you're all prepping for Thanksgiving and getting ready to talk to that uncle that loves a spirited debate. So let's give you something to talk about. Today, we're looking at a growing trend happening behind the scenes in the healthcare industry. You may have noticed some changes in a local healthcare facility, like a hospital, a nursing home, or some specialty clinic. Maybe it was a change of name, consolidating with other locations, or maybe there were signs of extreme cost cutting. If so, there's a good chance that local facility was bought by a private equity firm. Now, before you tune me out, because you heard me use the words of a finance bro, just sit tight. There is a good reason to pay attention to these private equity firms buying hospitals and nursing homes, partly because it's a trend that's growing very fast.
So now, alongside tech investing, the healthcare industry is the top target for private equity firms, at least in the US.
It's still a small player in healthcare, but its rate of growth is much, much greater.
Data suggests private equity firms' annual acquisitions in healthcare have seen a 20-fold increase from 2000 to 2018. Last year, private equity spent about $206 billion on over 1,400 acquisitions. That's according to PitchBook Data, a firm that tracks mergers and acquisitions. So let's start here and define what private equity is. I know it's been a while since Econ 101, so don't worry, I gotcha. A private equity firm pools money from a bunch of big investors. Think pensions, university endowments, and other institutional and highly accredited investors. Unlike other kinds of firms, which might be investing in growing companies or mostly trading in public markets, private equity uses this pool of money to buy entire private companies with the goal of maximizing profits, and then selling the company quickly, usually about 3 to 7 years later. Healthcare has become an attractive target for private equity for a few reasons. US healthcare itself is huge. It makes up about 20% of our GDP, and it's been growing steadily. A big turning point was the passing of the Affordable Care Act in 2010. With more Americans covered by insurance, and insurance expanding to cover more services, there was a sea of new opportunities to make some money, and healthcare acquisitions surged. The US also has an aging population, which demands more healthcare services.
And so this is a cash cow. They know they're going to be paid.
So we know the what and the why, but the real concern here is how. How do these private equity firms maximize profits in such a short amount of time? And what does that look like for the facilities they're buying?
They extract wealth by cutting costs, often in healthcare staffing, supplies, services. They may close hospitals or close emergency rooms. They may sell off the assets like the hospital's property and buildings.
Private equity is basically for-profit healthcare on steroids. Because private equity firms are looking to double or triple their investment in whatever kind of company they own over a really short time horizon, that just necessarily is at odds with the goals of many healthcare providers.
Cutting those kinds of costs in healthcare can have life or death stakes. It can close facilities that are crucial lifelines in rural areas or lead quality of care to plummet. The troubling patterns of private equity in nursing homes is well documented. There's a long list of examples where once thriving nursing homes fell into extreme disrepair, worker shortages get exacerbated, and there were deadly levels of patient neglect. In 2019, a team of researchers at the University of Pennsylvania looked at over 100 acquisitions in nursing homes. The data shows that deaths of residents in private equity firm acquired homes jumped an average of 10%. Now, there's still lots of debate over cause and correlation here. Private equity firms tend to target smaller operations that perhaps were already struggling. The American Healthcare Association, the largest nursing home lobbying group, also pushed back on the narrative that private equity ownership is the cause, saying the issue has become a distraction from the real issue, that all long-term care facilities need help with chronic government underfunding. But the correlation was strong enough to get President Biden's attention.
And as Wall Street firms take over more nursing homes, quality in those homes has gone down and costs have gone up. That ends on my watch.
Now, we want to be clear here. There's no reason for any owner to purposely run their practice into the ground. But the problem critics take with private equity ownership is that there's no incentive for them to keep the business afloat after reaping profits. For example, they're not legally liable for any debt they take on to buy a hospital in the first place. That ends up being the responsibility of the hospital itself. And since the firm is usually selling their purchase off soon, there's not much incentive to make sure their purchase is set up to thrive long term. Remember, the key word when it comes to private equity's business model, extraction. And that's the focus of some reforms.
There is legislation that was introduced by Elizabeth Warren called the Stop Wall Street Looting Act that would basically place limits on private equity firms' ability to extract wealth out of companies, make them liable for when companies are struggling or when they go under.
You know, private equity as an asset class is not going away. And we have been talking about the worst actors. We have to recognize there are people who want to do good and want to use private capital to make improvements. However, we need to be vigilant about how the lack of regulation and the easy ability to use taxpayer money can be used in harmful ways.
While momentum slowly builds on Capitol Hill, it's important to bring the spotlight back to the people who really matter at the heart of this story, the patients. It's not just a question of quality of care. Patients can be left with higher bills too. Private equity firms played an outsized role in the phenomenon of surprise medical bills. They've purchased practices that staff up ER rooms, anesthesiologists, or air ambulances for rural communities in particular. If you receive care from them, you might be seeing a sky-high out-of-network bill, even at an in-network hospital. So there's a good chance you've come across a private equity-run staff without realizing it. This sort of medical debt can be a lot to sift through, and it's still all too common in the United States. So for this next story, we actually want to take a breather, step back from the doom and gloom for a second, and focus on what we can do. What are the ways we can tackle the ever-growing pile of medical debt and the skyrocketing bills that come with it? National correspondent Chris Conti has been covering healthcare across the U.S. extensively and brought us this next story to tell us more.
It is often the last thing on our minds when we are rushed to a place like this. But every day, countless Americans end up in emergency rooms with no way to pay for the care they need.
Medical debt is something that is an unavoidable debt, like people don't choose to go into it.
But this story is not just about the fact that Americans owe more than $195 billion in medical debt.
How are we, as a nation, and states stepping in to help people?
A medical crisis shouldn't mean a financial crisis.
This is the single largest item on consumer credit reports.
Instead, it's a chance for Nicholas Cordova, Eva Stahl, and Jared Walker to give those drowning in medical debt a way forward.
It doesn't take a whole lot to kind of tip the scales for people.
Jared is the founder of $4, a nonprofit whose mission is to help Americans overcome medical debt by making sure hospitals are providing charity care whenever possible. Never heard of charity care? The idea is pretty simple. 6 out of 10 hospitals in the U.S. are nonprofits. In order to keep that status with the IRS, they have to provide charity care and financial assistance whenever possible, meaning if you fall within a certain income range, hospitals have to pay your medical bills.
Enforcing charity care is the lowest hanging fruit to help patients right now.
Problem is, most hospitals don't go out of their way to offer up charity care. So $4 has created a website. It's a database of every hospital in the U.S. and their financial assistance policies. All someone has to do is input their household size, income, and debt amount, and you can see instantly what kind of assistance you qualify for and be linked with a specialist to help navigate the process.
The problem is that nobody knows about it. Hospitals don't do a great job of telling people about it. So we have millions and millions of people declaring bankruptcy or on payment plans for bills they don't have to pay.
There certainly is a trend and a pattern to think differently about medical debt. You know, medical debt's not really a debt of choice. It's a debt of necessity.
Eva Stahl is with RIP Medical Debt, another nonprofit that helps people struggling with hospital bills. She offers these tips to consider to avoid medical debt. Sign up for public insurance if you qualify. Check whether specifics for upcoming procedures are covered. Always get an itemized bill to review charges. Check providers are in-network. negotiate directly with your hospital, and most importantly, never put medical debt on your credit card to avoid paying high interest charges.
People should be able to access the healthcare they need without the fear of devastating medical debt.
At the end of the day, a reminder that if you end up in a place like this needing care, the cost of care can often be mended as well. In Boston, I'm Chris Conti.